Welcome to the professional development of graduate lecture series organized by the alumni unit at the College of Medicine at Shakra University. Uh, Research writing. The research is an most important aspect in the mission and the vision of our College of Medicine. The professional developments of the graduates, uh, as our graduates are working in the hospitals and due to their tight schedules and the lack of time and the lack of guidance, the research output is deficient. So we need to fill this gap. The research unit at the College of Medicine and the alumni unit will work together to fill the gap to increase the output by our graduates. So in the professional development of graduates, our graduates, due to lack of the time and the guidance, not able to give the research output. And plus, if we collaborate with the research unit at the College of Medicine and with the alumni or graduates, we will give more impactful research. Example, what is the benefits of the collaboration? The research unit at the College of Medicine and the alumni institutions collaboration will leads to more fruitful research output. What will the role of the research unit here? The research unit will allow the research supervisors, or we can say faculty members, to alumni, and these faculty members or research supervisors will guide these our graduates during the research journey till the publications. What will be the roles of the alumni here? Alumni should collect the required research related data from their institutions. Example, if we need to collect the data of number of patients visited at outpatient department during the month of the June to month of the October, here we need the role of alumni. Which type of patients are visited the outpatient department, which type of patient visited the emergency department, and their clinical conditions and parameters. So if you will help in the collection of the data with your institutions where you are working as an internship, and by the ethical approval from the same institutions we need from the alumni, and simultaneously the coordination with the research supervisors. So this collaboration will have the research in the name of the alumni plus the supervisor and the College of Medicine. Why research? In addition to the Saudi Commission for the Health Specialties, for the matching of your specialty, it also build the your CV and plus your promotion and your interest area. The research is also important for the public health or common peoples for their management of various conditions. Just here, I will explain briefly some milestone research. Milestone research in the medical, if you see, uh, according to the survey of the BMJ journal, British Medical Journal, they found that some milestone research in the medical field. And obviously, the antibiotic, the epitome of wonder drug. The antibiotics are termed as wonder drug. Penicillin, in 1929, Alexander Fleming at the St. Mary's Hospital Medical School in London reported his observation that the culture medium on which a penicillium mold had grown attacked certain bacteria. And this was the accidental discovery of the penicillin. And we know that nowadays this penicillin is life-saving drugs for many human beings and in many conditions. So this is and the accidental research leads to milestone discovery. And simultaneously, meanwhile, if you see, there is an the gap now, research gap, celebration at drug resistance bacteria headquarter, and they are celebrating for the drug resistance, or we can say antibiotic resistance. So we need to focus to remove the antibiotic resistance infection conditions. Another milestone research is anesthesia, which is the symbol of humanity. We can't imagine the removal of tooth without the use of anesthesia. We can't imagine any surgical procedure from minor to major without the use of anesthesia. And in 1846, the discovery of ether is a milestone research in the medical. That William Morton succeeded in establishing the use of ether by demonstrating its effects at the Massachusetts General Hospital in October 1846 is due partly to serendipity. The ether worked and did not cause asphyxia, and partly to Morton's great ambition to expand his dental business with the method of numbing the pain of teeth extraction. And within 6 months, news of ether has spread worldwide. So, discovery of ether is also a milestone research in the medical science. And if there is a lack of discovery of ether or anesthesia, this will be the scenario. The patient may ask the doctor, may as well pull another tooth. We have got nothing better to do at home. Why? This is due to the anesthesia or ether. And if it is, imagine if there is a no ether and extraction of tooth, how painful it was. Third medical milestone research is chlorpromazine, unlocking psychosis. Now, if you imagine the psychosis condition, and it is very difficult to control the psychotic patient, their symptoms. And on 19 January 1952, a 24-year-old man who had mania was injected with chlorpromazine. Their reports to a meeting of the Paris Medico-Psychological Society described how he lay calm for several hours with his eyes shut. And we need this to manage the mania patients. So chlorpromazine is milestone discovery in the medical research. Imagine if there is no chlorpromazine, this will be the condition. I don't want to scare you. The mania patient conversation with the psychiatric. I don't want to scare you, but my last three psychiatrists all came down with paranoia. So this will be happen if there is absence of chlorpromazine. There are many discoveries of the in the research. which are milestone. Here are some: vaccines, conquering untreatable disease; oral rehydration therapy, the simple solution for saving lives; immunology, immunoglobulin, making magic bullets; and discovery of the structure of DNA. The best is yet to come, and we are able to manage the cancer by the DNA inhibition. Now, how to start the research? Read, read, and the read. We need to read it, write it, then rinse it and repeat. This is the process of the research. Read, write, rinse, and repeat. Here you need daily grinding. Many operations involved as per your interest and as per your specialty. You need to read the papers, select two papers as per your interest and as per your specialty. Suppose you wish to, if you used to do research in the neurology, multiple sclerosis, epilepsy, anyone wish to do research on the cardiovascular conditions, you need to read the paper according to your specialty and the interest. Then writing the reviews of papers and tracking the papers, tracking the paper of your field. What is the updates? What is the new inventions? Discussing ideas, having brilliant ideas and discovering which ones are worth bothering with, and keeping a journal that are related to your subject topic and the research interest. The anatomy of the manuscript. The anatomy of the manuscript, if we see the manuscript before publication or when we need to submit to the journal, it contains the title page, then abstract, introduction, methods, results, tables and figures, discussion, conclusion, and acknowledgements. This is the anatomy of the manuscript when we complete it, the complete research anatomy of the manuscript. But before completion, it will be quite different. The writing order, it is like not like that. The writing order is like this. If you decided your title or the interest, you need to do first is literature review. You need to do the literature review. You need to do introduction part and the literature review. In literature review or review of the literature, you need to see what has been done till date and what is the gap. So what has been done, you need to download and read many papers. Then after that, what you find out, what has to be done, then you need to see the methods. Which method you will be utilized for your research and what will be the cost tables and figures according to the methods. Then you need to write when you complete your methods as per the experimental protocol, you need to write the results. After results, you will get discussion. What is your current result and what is it is a synonym or different with the already published database. Then the conclusion, and after that you need to write the abstract, then title page, and lastly acknowledgement, which is quite difficult, which is quite different if you compare with the anatomy of the manuscript. In the abstract, if you see after title page, here is the abstract, but in actual writing The abstract is last one because you are able to write the abstract after the completion of experimental protocol or research, not before. Now, this is the introduction, or we can say the literature review. Before, what we are doing, we need to download hundreds of paper, then we need to analyze it, we need to mark it, what is the conclusion in this paper, what is the method utilized, what is the limitations, what is the advantage, and it took too much time. But now the era of the artificial intelligence, it is quite simple. I will let you know one artificial intelligent software that will help you to find out the literature review in short of time and qualitative output. Let us see the artificial intelligence in the literature review. In the Google browser, you need to type size space, and the typeset IO, you need to click on the typeset IO. It will be landed to the artificial intelligence charts for scientific. This will be the front window. And now here you need to type, suppose example, I will type here alprazolam misuse. Nowadays, the alprazolam misuse is too much. Alprazolam is a drug that are used for the anxiety, but its misuse are increased. Let us see. So I need to see what has been already published on alprazolam misuse. So this artificial intelligence software will give you answer from top 5 papers, and here the top 10 paper from the same your questions will be listed here. You can see PDF, you can also make it as an the reference. So answer from the top 5 paper: alprazolam, a widely prescribed benzodiazepine for anxiety and panic disorder, has been troubling rise in misuse, particularly in India and France. This misuse is driven by its euphoric effects and potential for addiction, leading to significant public health concerns. This paper is written by me. If you see the Pathan, in Malegaon, India, alprazolam is sold illegally under the names like dog pills. The kutta goli I mentioned here, it is in the local language, it is termed as dog pills, highlighting its accessibility and popularity amongst the youth. Because after taking this tablet, the youths are feeling well-being and they can do any crime. Now, this is the first one. This is my first paper published in the Neuropharmac Journal, and misuse of alprazolam as a dog pill among the youth and school children in the Malegaon city of India. Now, suppose I need to see here, this is the inside. Suppose I need to see here or add the conclusion of the paper. So I will add the one column here. You can click here. The conclusion of these all 10 papers will be here within a short seconds. If you too long didn't read, TLDR, click on here. So here, if the sometimes what happen, the papers are too lengthy and you are not able to read it, so it will give some summarized output. You can also add the column of summarize abstract, so you can compare here these all 10 papers, top 10 papers, with the summarize abstract. What were the results? You can compare it, you can cite it, you can write it, then which methods are used. So you can add, there is a plan. If you have you need to sign up with the your email address, and if you need to take the plan, so they will give all the information within quick period of time. Example, this is also work with the copilot. Suppose example, now I will click on this first paper, and now the copilot will work here, chat with paper. So example, now this is the paper, and if I will ask, you can ask any questions, explain abstract of this paper. So if you click here, this like the artificial intelligence will give the short and summarize abstract. So you need to give the prompt, and this prompt will answer the short and summarize abstract here. If you need to ask any question, conclusion from this paper, what is the conclusion, what is the method? Suppose I will ask any question. um, how many countries reported misuse of alprazolam? We can ask the questions, and if it is available in the paper, the artificial intelligence will answer. So this will be the answer for the misuse of alprazolam. Country reports, it says that it is available in the India and the France misuse of the alprazolam. So this is the co-pilot. You can ask any questions, and this co-pilot or artificial intelligence will answer your questions. Meanwhile, suppose now the result, suppose I wrote or draw the some points, and I need to make it as a points in my the literature review. So you can take the copy and paste. Plus, if you need to cite here, just click on the cite. If you see the citation, and here citations are available as per the format required: APA, MLA, Chicago, Harvard, Vancouver. If you need to BIP text or export to the EndNote or RIS, you need to just copy the text and paste into the reference section of your paper. Suppose now, if you take the important points from the each paper, and you need to delete it, just select from here, select from the paper here, and you can make it remove. You can delete these papers, and another 10 papers will be appear here. So you can utilize another 10, then you can extract the data, their reference, delete this 10 paper, and again you will get another 10 paper. So this software is nowadays very popular because it decreases the time, because literature review is one of the backbone for any research. Without literature review, we can't write any methods. So before any research protocol, we need to see what has to be done before, and now which methods or what research we are going to be done. So for this, literature review is very important. And before we are downloading the hundreds of PDF, then printing, after printing, we need to highlight and then frame, copy the text from them. Then we need to give the reference. Nowadays, very simple. You need to just have the specific prompt. Yes, writing the specific prompt is also very important. You need to write the specific prompt, and they will give you the answers in the short period of time. So this was our literature review, and we seen by the artificial intelligence by the software of the SciSpace. Thank you very much. Just care to make this more interesting than just statistically significant, because we all researcher, we need our research data to be statistically significant. So I would like to thank you for the alumni unit for the opportunity. And if the my graduate students are interested for the research, our research unit will collaborate for the collection of data with your institute. We will provide you supervisors, and inshallah we will have the fruitful and the significant, or we can say statistical significant research in the future. Thank you very much for your time.